Hey everybody, this is Alan Ting, TEDx speaker, #1 bestselling author. And in this series of Expert Series interview, we have a very special guest. He's got a very inspiring stories. I can't wait to have him share this with you. And today's topic, it's all about how to inspire the next generation of medical heroes. Our guest today is Dr. Brandon Pham, who is the co-author of the best-selling book, the Medical School for Kids Children book series. And you can definitely get that on Amazon. And he's also been featured on Fox, ABC, and CBS News. And he's also graduated summa cum laude from UCLA with a bachelor degrees in microbiology, immunology, molecular genetics, and not only that, he also received his medical degree from Stanford Medical School. He's currently a resident physician specializing in ophthalmology in the #1 ranked Bascom Palmer Eyes Institute in Miami, Florida. Welcome, Brandon. Thank you for coming to our show.
Of course. Thank you for that very generous introduction, Al. I'm so happy to be here, and it's a big pleasure to be invited to this podcast with you. I'm looking forward to chatting about anything and everything on this podcast.
So I understand your mission in life is to inspire children to get into medical work. Tell us about that.
Absolutely. So I think one of the most meaningful decisions I made in my life was to become a physician and pursue a career in healing others through medicine. And, I started this medical school for kids book series with my fiance, Betty Nguyen, who's also a physician in a different specialty, dermatology, because we wanted to share our passion for learning and our passion for medicine and our passion for our own careers with children in a way that was fun, engaging, easy to understand. And we started with our books, Medical School for Kids. We started with ophthalmology for kids, which is my specialty. And for Betty, dermatology for kids, just teaching children about the basics of the anatomy of the skin, the anatomy of the eye, and different conditions that can affect it, and how we can treat it and how we can have healthy eyes and healthy skin. And those books really blew up. They became very popular. People on Instagram, TikTok, or social media would comment saying, hey, you should do a book on cardiology or neurology, all these other specialties, and sort of blew up from there. And both Betty and I have been so passionate about education in different age groups. I've done other educational pursuits, Bruin Academy, iGrew, different sort of online educational platforms. Betty's done lots of tutoring as well. And this was such a unique pivot where we could actually be an important part in education for children. And it was so fun to make these books and see them come to life and all the different iterations. It's been really, really amazing. And we hope that through these books, we can inspire the next generation of doctors.
Yeah, absolutely. Speaking of inspiring the next generation of doctors, so maybe you can share with us, what inspired you to pursue in medicine?
That's a great question. There's a lot of things that went into my decision. I wasn't the type of person who very early on out of the womb, preschool, I was like, I need to be a doctor. That's what. And I also didn't have much pressure from my parents. Not like my parents was like, you need to be a doctor. That's the only way. A lot of it was I found it on my own. So in high school, middle school and high school, we all have broad education. We have a little bit of history. We have English, we have math, we have science. And I was always interested in science. I loved learning how things in the world work, how the human body works. I felt like that was one of the most amazing things I ever learned about all the different organ systems and the different cells and their different roles and how they're so specialized and intelligent and they work together. And so that's why I majored in, a science field when I started undergrad, microbiology, immunology, and molecular genetics. And I was fascinated by research that I was involved in. I think ultimately, so I know I wanted to do something sort of in the STEM field, the science, technology, engineering, but what really drew me to medicine was the fact that I wanted to dedicate my life to a career where I could improve the lives of others and in a way that was the most meaningful way, through health ultimately, I think is one of the most important things. And I think I've mentioned this to you before, Alan, but a lot of people take health for granted. And the moment someone loses their health, nothing else matters in life. All they want is their health back. And to be able to make that impact on patients' lives is really, really incredible. And it puts us in a position of a lot of responsibility, privilege. It's really just such a meaningful career. I felt that, improving someone's vision was what I really wanted to do. And that was something that was such an important part of a patient's quality of life. And it was so technologically advanced. It allows me to sort of use my interests in technology and lasers and all sorts of other imaging and diagnostic devices. And so that's how I came about in ophthalmology. But I think it was sort of a combination of my interest in science and math, and also sort of seeing the impact that doctors I had shadowed and worked with had such a big and long-standing impact on patients' lives, that really drew me to the career. And since I've been here, I've never looked back. I'm like, wow, this is like the best decision I've ever made.
Thank you for sharing that. And I don't know if you guys are listening out there, because a lot of parents, like, again, we're not here to blame or shame or judge by any means. We're like, I want my kid to be a doctor. I want my kid might be a dentist or pursuing the medical field. But I think they really left out a very important ingredient. And this is what you're talking about, which is your passion. And the passion comes with why you're doing this, because you believe fundamentally health is, is the baseline for all of our human experience. It's the baseline for all of our happiness. There's an Indian proverb that says, when you are healthy, you have 1,000 dreams. When you are sick, you only have one. As you're talking about that, I firmly resonate with that, because I live my health as baseline. This is a foundation. I got to be healthy, because if I'm not healthy, then I can't serve anybody else. Which brings back to number 2. You love serving with people. This is a combination of your passion and your why. Talk about purpose. Why do we do what you do? And a lot of people focus on fame. A lot of people focus on money, which is all great and all, but it doesn't sustain. Let me ask you if I can dive a little bit deeper, because I'm pretty sure at some moments in your life, you're kind of wondering, like, this is really hard. And maybe there are moments that you want to give up, but it was your passion and your why, which we talk about all the time, carry through. Do you have something like that? A story like you love to share?
For sure. I mean, there are so many, it's a long journey, and I'm already sort of near the end of my training at this point, having just one more year of my ophthalmology residency until I'm off in the real world. But for anyone who's considering a career in medicine, it's a long journey, and it's not just the length of time. I mean, there's a big commitment. So it's not just the 4 years of undergrad, there's 4 years of medical school, which are very grueling. And the analogy that any medical student will hear is it's sort of like trying to drink from a fire hose. All the information that you're trying to retain. It's not a stress-free environment. The pace at which you learn is very, very fast. You're expected to go through an organ system in a week or two, and then you're moving on to the next one. A lot of tests, a lot of examinations. You'll be doing that for, the rest of your life as a physician, because medicine is always changing. So there are many times during medical school where it's very stressful. First 2 years you're in the classroom, third and fourth year in your rotations. I remember during my general surgery rotation, it was, I'd be waking up at 4 a.m. Sometimes surgeries would run late and they would go till 8, 9 p.m. The culture in medicine in certain surgical fields, you're just sort of expected just to get in early, see all the patients, go in the operating room. There's no complaining. You're just working nonstop. There's not time for lunch sometimes. I mean, it's tough. And, you get through it. Obviously, you learn an incredible amount. You learn grit, resilience, strength. You learn a lot of medical knowledge as well and surgical skills. But there are a lot of times where I was in medical school and I'm like, what am I doing? I'm getting all this debt. I'm working 16 hours a day, but I'm not actually working. I'm not getting paid for it. I'm paying to be here. I have friends who are in different, to pursue different careers, and they're starting their jobs already. They're making money. They're not working nearly the hours that I am. And I was like, I'm going into a hole. I think if you ask anyone who's a physician, that thought always sort of comes across your mind. And there's always those, day-to-day struggles of, just medicine or seeing a poor patient outcome, or thinking that, is there something else we could have done for this patient? That always comes up. So there's a lot of struggles. The journey, patient outcomes, feeling like, maybe you're an imposter syndrome, or that you don't belong here. At the end of the day, privilege that you have in being a medical professional, a physician, being a leader in someone's health, I think that outweighs everything. And ultimately, you need that training, and you need that entire experience, the hundreds, thousands of hours where you're in the hospital, in the clinic, to become the best possible physician. So I certainly, don't regret going through, all the prerequisites for medical school, and then, medical school, now residency. That has all made me stronger and made me the best possible physician I am today. So it's not an easy journey, and I think everyone should know that. But you can talk to any doctor, and there's struggles throughout the process, but it is really worth it in the end.